Welcome to today's program. Staying hydrated, staying healthy. Water is the driving force of all nature. As this quote from Leonardo da Vinci points out, water is life. All living things need water to survive and consist mostly of water. About 60% of the adult human body is water, and it depends on water to function properly. We can survive weeks without food, but only days without water. Water aids many essential processes to keep us going, including but not limited to its amazing ability to dissolve many substances, enables our cells to use minerals, other nutrients, and oxygen in biological processes. Blood is 90% water, and it transports oxygen and nutrients to every part of the body. It regulates body temperature through sweating. It flushes body waste primarily via urination. It lubricates joints and cushions the brain, spinal cord, and other sensitive tissues. We lose water during the day through breathing, sweating, urination, and bowel movements. Therefore, we need to replenish ourselves with water every day to keep hydrated. Adequate hydration has numerous health benefits, including maximizing physical performance. Proper hydration is vital for sportspersons. When we exercise, we lose water via perspiration to maintain body temperature. If water loss through sweating outpaces fluid intake, signs of dehydration will start to emerge and impact physical performance negatively. Dehydration reduces the blood volume, hence hindering the oxygen flow to muscles and increasing the injury risk. In addition, dehydration is detrimental to the lubrication of joints, which is critical to deal with additional tension during exercise. Moreover, dehydration can cause electrolyte imbalances and hinder muscle and nerve functions. To stay hydrated for sports, a rule of thumb is to drink 500 milliliters of water 30 minutes before exercising and 200 to 250 milliliters at 15 to 20-minute intervals during your workout. For moderate amounts of exercise, water is the best drink to replace fluid loss. For extensive workouts, a sports drink may be necessary to replenish electrolytes. Preventing kidney stones. Kidney stones are quite common. About 1 in 10 people will be affected during their lives, and half of the people who have one will develop additional stones within 5 to 7 years. Kidney stones begin to form when the waste products in the urine are getting too saturated and crystallize. When the crystals grow into stones, they may stay in the kidney or travel down through the urinary tract. And if the stones get stuck and block the flow of urine, they can cause severe pain, kidney function impairment, or urinary tract infections. Drinking lots of water every day is the best way to prevent kidney stones, as the extra hydration dilutes the minerals that lead to stone formation. The UK's National Health Service suggests those who have had stones before should strive to drink 3 liters of fluid every day to lower the risk of further kidney stones. Most of the fluid intake should be water, and adding fresh lemon juice to it also helps. Lemon juice becomes alkaline when digested, and when the urine is less acidic, stones are less likely to form. Preserving brain function. The human brain is approximately 75% water. Therefore, water is an essential nutrient for the brain to work optimally. Studies have shown even mild dehydration of 2% of body mass can cause impaired cognitive function in areas of memory, attention, and processing speed. In a research study involving children ages 9 to 11, more hydrated kids performed better in terms of response time and multitasking in cognitive ability tests. Dehydration also can lead to stress, anxiety, and depression, as dehydration impedes the production of serotonin, the key neurotransmitter that stabilizes our mood, feelings, and sleeping pattern. Lack of water also reduces the brain's oxygen supply, thus may induce headaches, migraines, and fatigue. By drinking adequate amounts of water, you can keep your brain functioning well and operating at its best. Here are some additional health benefits of keeping hydrated. Regulating digestive system. Your stomach requires water to produce digestive acid to break down food, and the stomach's lining needs adequate hydration to build a thick mucus layer to protect itself from the erosion of very acidic digestive juice and the attack of ulcer-causing bacteria. Water helps the food you consume to travel through your intestines. If your body is dehydrated, your colon will pull water from the food you eat to hydrate the body. If there is not enough water available, food becomes difficult to pass down the digestive tract, causing pain, constipation, or bloating. Blood pressure control. Blood pressure is the amount of pressure that's exerted against the arterial walls of vessels when the heart pumps the blood throughout the body. When it is consistently higher than the recognized normal pressure ranges, it is considered as high blood pressure. We know that high blood pressure is associated with unhealthy diets and lifestyles, such as excess sodium intake, consumption of high saturated fat, physical inactivity, smoking, and alcohol consumption. However, chronic dehydration might also lead to high blood pressure. Initially, when someone does not drink enough and becomes dehydrated, the blood volume can decrease due to a lack of water. This will then lead to a drop in blood pressure. It can usually be quickly resolved by replenishing with water and adequate electrolytes. Yet, if someone is chronically dehydrated, the brain will send a signal to the pituitary gland to secrete vasopressin. Vasopressin is an antidiuretic hormone that regulates the kidney's water control and constricts the blood vessels. As a result, the blood pressure is increased to help the body stay functioning. So, always remember to keep yourself hydrated to maintain a healthy blood pressure in the short and long run, as well as to lower the cardiovascular risks associated with high blood pressure. Given the various health benefits of water introduced earlier, proper hydration is especially important for seniors. Since body water content decreases and the sense of thirst diminishes as we age, older adults are at a higher risk of dehydration versus their younger counterparts. Inadequate hydration in seniors is associated with morbidity and mortality. In a 2015 study, 37% of the 200 people aged 65 or older admitted to a hospital were dehydrated. Within the group, 7% passed on in the hospital, and of those individuals, 79% were dehydrated at admission. To prevent dehydration, seniors can incorporate nutritious vegetable soups in their diet, as well as veggies and fruits with high water content. Watermelon, strawberries, peaches, celery, cauliflower, and tomatoes are some excellent choices. For caregivers of elderly individuals with dementia, it's a great idea to set a timer and remind you and them to drink fluids during the day. And for seniors with limited mobility, keeping a glass of water within their reach in their frequently used areas, such as on the bedside table or nearby their favorite seats, is a simple way to increase their fluid intake. So, how much water do you need to drink every day? As a general rule, you should drink 8 250 milliliter glasses of fluids, which equals 2 liters. However, it really depends on many factors, such as how active you are, your health, and where you live. If you have the flu or urinary tract issues, you'd need to drink more water, and you will need more water in hot and dry areas and at higher altitudes. According to the Wilderness Medical Society, the lower oxygen level at higher elevations makes you lose more water through respiration. Besides, at higher altitudes, the humidity is lower, hence your body evaporates water faster. Your diet also plays a role in water requirements. You will need more water if you don't consume water-rich fruits and vegetables regularly. In addition, men require more water intake than women, as men have less body fat and thus a higher body water percentage. Having said that, you don't need to be overly concerned about the exact amount of water consumption each day. In general, just obey your thirst, your body's delicate signal to you that you need to restore your water level, similar to hunger, and adjust according to your activities and health status.
Vegan, because tortured, maimed, murdered flesh and blood are not food.
Thank you, elevated viewers, for your company today for our program.